So I wanted to talk to you a little bit about this because, some of our friends are up on stage there talking about, you had Karen DeSalvo, you had Anish Chopra, you had Governor Levitt, Seema Verma. They took the stage and they talked about information sharing within healthcare and how we're ushering in a new era of innovation because of the information blocking rules that CMS had come out with, and including the payer data as well, and now making that available to a consumer-initiated request, but making that available to the consumer. And the premise is essentially that we could now see a whole new generation of data aggregators and people who take that data and data stewards, really, who take that aggregated data and provide intelligence and insight onto it and provide value to the healthcare consumer moving forward. That's the premise. And I wanted to talk to you about the intent and really the impact of that announcement from your seat and from your perspective.
Well, first, I think the impact can't be underestimated. I think it was a big announcement, and it's going to have some big effects in terms of what happens going forward, for no other reason than that, all of those vendors that were on the show floor at HIMSS are probably now going to redirect, much as they did with meaningful use, a large portion of their R&D development and sort of opportunistic time towards meeting those new regs and regulations. And I think that, they're not insignificant, and there's sort of a lot to do. That being said, I think that I'm still trying to digest them. It's 1,000 pages, and I wish I could tell you that I've made my way all the way through it. I paused for a little bit and alternated between reading and skimming and reading and skimming and skipping. Ultimately, I think, I've gotten a little bit of the gist of it, and thankfully, lots of folks have published some really good commentary. But, it's an interesting set of regs. At a high level, frankly, as a consumer, I'm unbelievably pro the idea of making information available. I think it's hard to find folks in healthcare that sort of have a mission orientation. I would say that it's their data and they won't share it. I know there's lots that get sort of covered around that, but for most folks, the intention is pretty much there. I think the hard part is going to be, what does it all mean and how do we do it? I always worry about when government regulation is put in place, it has to, by definition, move the needle or move one or two things forward. And it ultimately, can run the risk of unintended consequences as, sort of the implementation finds an equilibrium. So I'll give a couple of examples. When, in the regs, they talk about releasing all data that's in any certified EMR. That's different data across different EMRs. And by the way, do you really need all of that data? Do you really want all of that data? If you got all that data, would you even know what to do with it? Do you get to a point where maybe too much information is just as bad as not enough information? And so how are we going to sort of translate that and sort of open all of that up? But, as a whole, I think that CDERS generally has tried to adopt the philosophy of we'll make information available anywhere at any time in whatever format you want. What I love in theory about this is that it takes an organization like Cedars-Sinai and says that if our patients want access to our data, and increasingly we're starting to see that happen, then they ultimately have a choice of how they do that. We will provide tools for them to see the data and interact with the data, and hopefully they'll find our tools delightful and want to interact with their data in our tool sets. But if they don't, and they want their own tool sets, or they want to do different things with it, they can take their data and work with that in different formats in different ways. There's some great altruistic ones, like I want to download my data and donate it to science for research. It's wonderful stuff. Some of them I frankly worry a little bit about, in that, what happens when a family member of mine decides to download their data, which parenthetically has a large amount of family history, so indirectly information on me, and chooses to sell their data for whatever purpose the individual wants to use it for, but they're just happy to get the data. Did I really consent to give my data? How does that work? And I think that, we're going to have to figure out sort of some of those things. I'm not saying any of that it should stop us from moving forward, but, I think that the unfortunate part is I think there's a 60-day comment period, and then there's a relatively short implementation period. This is going to be a little bit of trial by fire, and I think we're all going to have to sort of hold on to our hats a little bit as this starts to roll out.
Yeah, it's really complex. The example I always use on this for a government reg is the transparency rules. So transparency rules, you have to publish the prices of things. And I was wondering how this sort of played out. So I hit a couple of sites, and it's not the easiest thing to even find the numbers on them, but they're there. So you find them, and on some of them, you literally download a spreadsheet with 1,000 items on it, and you have to determine which kind of MRI you got to see what the or you're going to get to determine what's the price. And I think what people don't really grasp, what a consumer doesn't grasp, what somebody who's not in healthcare and healthcare IT doesn't grasp, is the information that's in that medical record is extremely complex, not easy to digest for the average person, and it's fairly nuanced between this kind of MRI, this kind of MRI, this kind of MRI, and so you can't just say an MRI costs this. Because there's the charge master as well as I do. There's millions of items in there, and the intent of a reg and then how it gets implemented. I'm sure if you went to Seema Verma and said, "Hey, there's spreadsheets out on people's websites and they sort of look like this," she'd say, "All right, it's a start." And then we hear this a lot. That's the start. That's not really what the intention was, but that's a start. And I think what you're saying is we're going to see the same thing here with a lot of different interpretations of it and a lot of different implementations of this particular data blocking and sharing reg.
Yeah, and I think it's going to be one of these sort of incremental journeys that people will discover. And I'll go back to Apple because I really do give them lots of kudos for what they did with Apple Health. What we really loved about it, and ultimately the reason why we sort of raised our hand and went first with them, was that there was lots of folks that were asking for their data to quote unquote download it. So we did that a while ago. We made it available on our patient portal. You can go in, you can, again, as I said, hopefully you find the experience on our portal delightful and you want to view your data within there. But if you don't, you can hit the download button and away you go. But if you hit the download button, it was sort of disingenuous because we gave you an XML file. And I don't think patients, wake up in the morning and say, what I really want is an XML file of my data. And so what Apple Health did was it gave you a vehicle to really sort of use it. Yeah, and it was also great because it used, standard-based APIs, FHIR, blah, 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 blah. But, what it really did was it gave the consumers a taste of what they really wanted, which was I want my data and I want it in a usable format that I don't have to figure out how to consume. Somebody has figured out how to sort of give it to me in a consumable way. And I think we're going to have to figure that out with a lot of what's, in sort of these regs and sort of in these pieces. I think that there was a lot of Silicon Valley influence in those regs. And I say that from the perspective of there was a lot of VC-backed companies that I think felt like they couldn't get their applications to get data. And so that became synonymous with patient rights of getting data. I'm not sure those are exactly aligned in what patients are sort of looking for. They might be, but I'm not sure they are fully. And as some of those things sort of play out, it'll be interesting to see what people really want to use. And as you know well, and your listeners know well, it's what will really be fascinating, frankly, is what percentage of patients really choose to engage in this information and what they really want. I mean, I don't know the national numbers around patient portals, and we can knock them because we can say maybe the patient portals aren't perfect, but that's just part of the problem. Part of this is that patients aren't engaging in some of the information that's available to them. So it'll be interesting to see who are the early upticks of this. And I suspect it's going to be more third parties than it's going to be patients themselves that are after some of these API connectors.
Right, because they're going to make meaning of it, right? So it's the old adage of Mint, the Mint of healthcare. So it's not like I can't get all of the information that's in Mint from each one of my banks and my brokerage and everything else. But what they're able to do is pull it together, give me one view to it, give me a nice budgeting, charting, and all that other experience. And that's what I expect and hope will happen in healthcare. Not that somebody's getting my entire medical record, but somebody who's helping me with diabetes is, getting that portion of it and presenting the data in a way I can consume it. Because, just handing, I'm glad you handed people an XML file. That's a lot better than what the alternatives are. But, it used to be we were carrying around a stack of papers. Then it was, a blue button kind of thing of here's your medical record, which you can't really do a whole heck of a lot with, to hopefully we'll get these data stewards, which are in between the health systems and the payers and the consumers, that can create, just meaning from all this data that can help me to live a healthier life. I think that's the goal of patient-centric interoperability.
Yeah, I agree. And I think the inherent challenge in that, I'll say it this way. When that eventually gets solved, and I am optimistic that we will get closer and closer to that, when we look back on the journey, my opinion is that the ability to get the data, which is really what the announcement was all about, is going to have been the easy part. The really hard part ahead is how the heck are we going to normalize that data and make what is today, esoteric configuration that exists in each of the different systems somehow matching. And, the old joke in healthcare is we like standards so much, we have many of them, but so we're just going to have to figure out how all of that stuff is going to sort of come together. But again, I don't mean this to come across as sort of negative. It has to start somewhere. And so I think that this is a great place. I just hope that it continues to take an orientation that's really about the patient being able to get their information so that they could ultimately be a custodian of their healthcare. What I worry about, and there's some language in the regs or in the draft regs that allude to this, is there's some real interest in making these APIs right as well. And I think, a lot of that language feels like it was around trying to level the playing field from a vendor perspective. And I'm not sure that was, at least in my opinion, the main effort of what these rules really should have been. I think if they stick to this idea of empowering, enabling patients, I think it will be hard to get too far off track because it's a good true north for us to focus on. But if they start to drift into everybody's system has to be open to everything from a read and write perspective, I start to worry about it. And I just don't know how we're going to maintain not just normalization of the data, but then ultimately integrity of the data as we all have to start to police what everybody is doing.